let me introduce to you my fantastic panel who are going to be reflecting on what we heard there from Honorable Minister Mandavia, as well as the Secretary of State, Sajid Javid. So we have with us author, political communications strategist, Priyam Gandhi Modi. Welcome to you. How are you today?
Thank you for having me.
Excellent. Director of Technology Policy, NHS England, Catherine Pollard. Thanks for being here. Founder and CEO of My Healthcare, Shaito Raha. Thanks very much.
Thank you, Edie.
Welcome. Welcome to you all. And let's also welcome our virtual guests as well, the Joint MD of Apollo Hospitals, Dr. Sangeeta Reddy. How are you?
Good afternoon. I'm well, thank you. And it's a pleasure to be with you. Namaste.
Namaste. And we also are very pleased to have the CEO of the National Health Authority of India, Dr. Sharma, Dr. R.S. Sharma. How are you today? Good afternoon.
I'm fine. Thank you very much.
You know,
And
Dr.
good afternoon to you all.
I don't know if you were able to listen to the last session, Dr. Sharma. Did you hear it?
I did. I was there in the panel.
I
mean,
wonder,
in the listening.
I'd love to hear your reflections on what you heard from the minister. What do you think was really important to pull from Honorable Dr. Mandavia's comments that you'd like us to reflect on?
Thank you very much for inviting me in this panel. I think it's very important issue. The health is an extremely important issue. And Dr. Manvia spoke of a number of things, and I'll dwell on two of them. One is the digital, health mission which India has started in September last year, and of course when the Honorable Prime Minister Boris Johnson came to India in April, there was a joint communique, and that spoke about the collaboration between the National Health Authority and the National NHS of UK in the digital health area and many other areas. And what we have embarked upon by way of digital health mission is essentially, putting all the pieces together, the building blocks, necessary building blocks, which essentially will ensure that a common person is able to book, search, and avail all kinds of services, whether it is ambulance service or other medical services. The overall architecture and overall mission of the digital health mission is to leverage the information and communication technologies to deliver affordable, quality, and accessible health services to our people. So that's the broad one part which we are doing. Dr. Mandavia also spoke about the largest health insurance scheme in the world, which is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which actually covers 500 million people and provides an assurance, health assurance to the tune of 500,000 rupees per annum for each family. So that's again a scheme which is being implemented, and we have spent about $7 billion thus far in the last 3 years. So we are spending about $1.5 billion every year on an average. So that's another scheme which we are running, and we think that the digital mission which the PM has launched, that is the future of healthcare. That is the way we will be able to ensure that we have an affordable, and Dr. Mandavia made a very strong mention of the affordability of the health services, and that will make it affordable. Also, it will actually provide access to everybody in the country, and that's the broad objective of the digital mission. So that's where I stop.
Access to everyone in the country. And when you think about a country like India, it's extraordinary. Dr. Sharma, I want to bring you back in because you've mentioned, we also heard from the Honorable Minister, Ayushman Bharat, the world's largest government-funded health assurance scheme that you're responsible for. And you're also responsible for the National Digital Health Mission, ABHA, aiming to develop that backbone necessary to support the integrated digital health infrastructure and the centralization of these national health records, which hasn't been done before. It's an extraordinary task. I want to move this discussion to how mobile is going to help you do that. How are you going to use mobile technology to communicate with people as well as you build these infrastructures, Dr. Sharma? Oh, I think you're on mute. I'm not sure if that's your side or ours.
Yeah, sorry. Thank you very much for that question. So, one is that I want to clarify that it is not a centralization of health records. In fact, what we believe in is essentially the fact that it is the patient who should be in control of his or her health records, number one. Number two, we also believe that the health records must remain where they are created, which means we are not going to consolidate and capture all the health records. This is what we call the federated data structure, which the been federated, only the link will be there in the patient's mobile. So that's one part which I want to make it clear. Secondly, the digital mission which we are creating is essentially a kind of framework which is interoperable, which is actually inclusive, which also, all kinds of disparate applications can connect with it. And that's the way it is going to operate, because in a country of 1.4 billion, you cannot have a single monolith system. This has to be a completely distributed architecture of the system. Nevertheless, it should not kind of lose the track in the sense that it becomes silos. It's actually distributed, but at the same time it is also possible to have one person have his entire longitudinal health record. So that's another very important aspect of digital mission which we are carrying out. COVID, for example, now we are going to have about 2 billion vaccination records on the system. It is 1.976. About 5 minutes back I saw that number, and that number is basically a real time number which is being collected on the COVID. And this is the kind of, similarly we built digital identity called Aadhaar. We have a UPI, which is the payment system, which did about 6 billion transactions last year. The mobile penetration of our country is 1.2 billion mobile connections, 800 million internet connections, 600 million smartphones, and the data rate is as low as about 10 US cents per gigabyte. So actually, there is a digital infrastructure which is there in the country. It's a 4G connectivity. Now it's going to be 5G after some time. And we are leveraging all these, horizontal digital artifacts, digital public goods, as we call it. Similarly, the health related National Digital Health Mission or Ayushman Bharat Digital Mission is also creating digital public goods which should be able to be used by various stakeholders. For example, we are creating the health claims exchange, which will ensure that not only Ayushman Bharat PMJY, but also other insurers will be able to, other providers will be able to latch on to the system, other insurer payers will be able to use the system. So it's like a pipeline, it's like an exchange which we are going to create. So what we are looking forward to is that our experience of creating such large scale, scalable, interoperable, based on open standards, based on open APIs, all these digital public goods, we are going to look, we are going to use them to deliver the maximum advantage. So that's what is our vision of digital health or digital commerce or other kinds of artifacts which we are creating.
Fascinating. Thank you.